family or anyone calls us to ask questions about the services that we provide, because we fall under the realm of mental health, we have to pretend like we don't know who they're talking about if we don't have a signed release of information. So even if a primary care doctor, let's say, called me and said, I've heard you're treating Herschel and I want you to know what I think he should work on. I have to pretend like I've never heard of Herschel, and I have to say very cryptic, bizarre things like, if I had a patient named Herschel, I would be glad to take some notes about what you think would be appropriate. And then if I did have a patient named Herschel, I would be able to see if he will sign a release that would allow me to speak with you. And if he signs that release, I mean, it's very bizarre, but we have to protect the confidentiality. It's mental health. So to your question about Ted, if he called, I would have to pretend like I have no idea who he's talking about.
Yeah, but can that present a problem because the LCSW, they're not the doctor. So if the doctor is trying to treat the patient and the family's not there, or somebody with the power of attorney, and this person isn't incompetent, but on the other hand, they're not going to be, signing a bunch of paperwork like the one person said. So it seems like that's kind of taking away the doctor's role and putting it in somebody that's not really qualified to be the doctor.
Well, we're not doing anything medical. We're providing clinical services, so we're doing talk therapy. But that's not to say that I can't listen to what the physician has to say and then go back and say, Herschel, your doctor called me. Do I have permission to speak with him? If so, will you please sign here that allows me to speak with your doctor? Because if he won't sign it, all I can do is listen to the doctor and take information from the doctor, but I am not permitted by law to share information with the doctor unless I have that signed document. That's mental health law.
But like older people, they don't want to be around doctors anyway, or keep doctor's appointments, so they don't want to sign any release because they don't want to hear from the doctor anyway. They just want to.
Well, and sometimes what I can do is to explain to patients that my connection with their other providers is helpful at keeping them out of multiple appointments and keeping them out of having to go to the hospital, that if I can communicate with their doctor and say, here's what I'm seeing, the doctor may be able to send another prescription or something like that, as opposed to having to go in for an appointment. Do you have more questions?
I have just one more question. How can I get my dad to see you? Do you need a doctor's note or?
No, you don't have to have a doctor's order for us. All we need to do is have a cooperative Herschel.